Your doctor gave you a prescription and said, take 1 tablet daily. So you did exactly that. Every morning, same cup of coffee, same kitchen counter, same routine. And if you are over 60, there is a very good chance you have been taking it that way for years without ever being told the one thing that may matter more than almost anything else. Not just whether you take your blood pressure medication, but when you take it. Because the wrong timing can leave your heart, your brain, and your blood vessels exposed during the exact hours they need protection most. And the dangerous part is this. Most people think they are being perfectly consistent. They are disciplined. They are compliant. They are doing exactly what they were told. But they may still be taking their medication at the most vulnerable time of day. Today, I want to walk you through the 5 biggest timing mistakes people make with blood pressure medication. And the number one mistake is the one hiding inside the most common routine of all. I'm Dr. Clara Hoffman. I created this conversation for people who want more than a rushed explanation and a label on a pill bottle. Because when it comes to blood pressure, a few words like once daily are often not enough. The details matter, the timing matters, and after 60, those details can matter a great deal. Before we go further, think about your own routine. Do you take your blood pressure medication in the morning, in the evening, or whenever you happen to remember? And have you ever missed a dose and tried to make up for it later? If the answer is yes, you are far from alone. To understand why timing matters, you first need to understand something your body has been doing quietly your entire life. Your blood pressure does not stay the same all day long. It follows a rhythm. At night, while you sleep, blood pressure is supposed to fall. Then in the early morning hours, your body starts preparing you to wake up. Stress hormones rise. Your nervous system becomes more active. Your heart and blood vessels shift into daytime mode. That is when blood pressure tends to surge. And for many older adults, that morning surge is one of the most dangerous cardiovascular windows of the entire day. This is why medication timing is not just a convenience issue. It is a coverage issue. The question is not only, did you take your pill? The question is, was that pill active when your body needed it most? Let's start with mistake number 5. One of the most common habits I see is taking a beta blocker right alongside morning coffee. It feels harmless. In fact, it feels normal. You wake up, pour the coffee, take the pill, and move on. But beta blockers are designed to calm the cardiovascular system. They slow the heart, reduce the force of contraction, and blunt the effects of stress hormones. Caffeine pushes in the opposite direction. It stimulates the system. It nudges the heart rate up. It can temporarily raise blood pressure. It can make some people feel wired, jittery, or fluttery in the chest. Now, for some people, this overlap causes no obvious symptoms at all. But for others, especially those prone to palpitations, that morning collision between caffeine and medication can create a rough start to the day. They do not always describe it as a drug interaction. They say, I feel off in the morning. They say, my chest feels fluttery after breakfast. They say, I thought it was anxiety. Sometimes it is not anxiety. Sometimes it is timing. If you take a beta blocker, a simple adjustment may help. Take the medication with water and give it some space before that first cup of coffee. Not every person needs the exact same interval, but crowding the two together is often unnecessary. Small timing changes can reduce a surprising amount of morning discomfort. Now, mistake number 4. This one hides in the refrigerator. Grapefruit or grapefruit juice, or a citrus blend people do not even realize contains grapefruit. Many patients have heard that grapefruit can affect medications, but they assume it is a minor issue, or they assume it only matters if the juice is taken at the exact same time as the pill. That is where people get caught. Certain blood pressure medications, especially some calcium channel blockers, can be affected by compounds in grapefruit that change how the medication is processed in the body. That means the drug may not behave the way it was intended to behave. Its level can rise higher than expected. Its effects can become less predictable, and in an older adult, when blood pressure falls too far or too fast, the consequences are not trivial. Dizziness is not trivial. Lightheadedness is not trivial. A fall in the bathroom, in the kitchen, or beside the bed is not trivial. People hear fruit juice and think harmless. But harmless is not the same thing as compatible. If you are taking a calcium channel blocker and you are not absolutely sure whether grapefruit is safe with your exact medication, that is not something to guess about. That is something to verify with your pharmacist or physician. Because with blood pressure medication, probably fine is not a strategy. Mistake number 3 is one I want older viewers to hear very carefully. Taking a diuretic too late in the day. These are water pills. They help your body shed extra fluid. They reduce volume in the bloodstream, which helps lower blood pressure. The problem is not the medication itself. The problem is the clock. If you take a diuretic late in the afternoon or in the evening, you are often pushing its peak effect into the night. That means more trips to the bathroom, more interrupted sleep, more standing up in the dark when your body is half awake, more chances for unsteadiness, especially if your pressure drops when you stand. This is one of those mistakes that looks small until it is not. It looks like inconvenience. It looks like poor sleep. It looks like I'm just getting older. But nighttime bathroom trips are not always harmless. For some adults, they become the first step in a fall that changes everything. That is why timing your diuretic earlier in the day is often so important. Morning timing usually makes far more sense than evening timing, and when a second dose is prescribed, it often needs to be placed carefully so the night is protected. Many people were never told that. They were simply told, take it daily. And the body pays the price for that missing detail. Now, mistake number 2, trying to fix a missed dose by doubling up later. Almost everyone has had that moment. You forgot the morning pill you remember at lunch, or dinner, or right before bed, and your brain says, I'll just take 2 and get back on track. That instinct is understandable. But understandable does not mean safe. Different blood pressure medications behave in different ways. Some are long-acting. Some have stronger blood pressure-lowering effects at peak concentration. Some combinations can make sudden drops more likely, especially in older adults whose cardiovascular systems are less forgiving than they were at 30 or 40. When people double a dose without guidance, they are not correcting a simple math problem. They may be creating a blood pressure swing their body is not prepared to handle. That can mean dizziness. That can mean weakness. That can mean fainting. And in someone with underlying heart disease, vascular disease, or frailty, that can become an emergency. There is another version of this same mistake that gets less attention. Some people prescribe twice daily medication, quietly turn it into once daily medication because it is easier to remember. They do not tell their doctor. They do not think they need to. But blood pressure control that looks good enough for part of the day may be quietly wearing off when protection is actually needed. This is why routine matters. Consistency matters. Honest reporting matters. If you are missing doses often, the answer is not secrecy. The answer is a better system. An alarm, a pill organizer, a fixed anchor habit like brushing your teeth or eating breakfast, anything that reduces guesswork. Because blood pressure medication works best when the body is not being forced to chase inconsistency. And now we come to mistake number 1. The biggest one, the one hidden inside the most common instruction of all. Taking every blood pressure medication in the mornings simply because that is how it has always been done. For decades, take once daily in the morning became the default language of blood pressure treatment. It was tidy. It was easy to remember. It fit the structure of a normal day. But easy and ideal are not always the same thing. Remember what we said earlier. Your blood pressure often rises most sharply in the early morning hours. That means the most dangerous window may begin before breakfast, before coffee, before most people even open their eyes. Now think about what a morning dose may mean. If you swallow your pill at 7 or 8 a.m., it still has to absorb, it still has to circulate, it still has to reach effective levels. And by the next early morning window, depending on the medication, its strength may no longer line up as well as you think. This is where the conversation becomes important. Not because every person should automatically switch to bedtime dosing, and not because every blood pressure medication belongs at night. That would be too simplistic, and medicine is rarely that simple. But for some patients, especially those whose blood pressure pattern stays too high overnight or surges dangerously before dawn, bedtime dosing may make far more physiological sense. In other words, the right medication at the wrong time may not be giving you the protection you think it is giving you. That is the real issue. Not whether morning dosing is always wrong, but whether your timing matches your blood pressure pattern. Some people are well controlled on morning dosing. Some are not. Some look fine in the clinic and still have poor overnight control. Some need a more individualized plan than the pill bottle label provides. This is why one of the most valuable conversations you can have with your doctor is not, "Is my blood pressure medicine working?" It is this: "When is my blood pressure highest, and is my medication timed to protect me during that window?" That is a far better question. And if your doctor thinks it is appropriate, a 24-hour blood pressure evaluation can reveal patterns that a single office reading never will. Because a blood pressure reading at 10 in the morning does not tell the whole story of what happened at 4 a.m. And 4 a.m. may be exactly where the story matters most. Let me say something clearly here. Do not change the timing of your blood pressure medication on your own just because a general video told you to. Some medications are better suited for one time of day than another. Some people are more prone to dizziness at night. Some are at risk for falls. Some have kidney concerns. Some take multiple medications that need to be spaced carefully. Personalization matters. But what should absolutely change today is your awareness. Because many people have spent years believing that if they take their medication faithfully, they are fully protected. And faithful timing is not always the same as strategic timing. That distinction matters, especially after 60. Especially if your morning readings are high, especially if you wake with headaches, pounding in the chest, dizziness, or unexplained fluctuations. Especially if your numbers look acceptable in the clinic, but something still does not feel right. Your body is not failing you because it needs support. And taking medication is not weakness, it is as a tool. But like any tool, it has to be used correctly. The hour matters, the pairing matters, the consistency matters, and the hidden mistakes are often not dramatic mistakes. They are ordinary mistakes. Coffee too close to the pill, grapefruit you forgot to count, a diuretic taken too late, a missed dose handled the wrong way, a morning schedule followed blindly when your body may need something different. That is how risk hides. Not in obvious chaos, in ordinary routine. So here is the question I want you to think about before your next dose. Are you taking your blood pressure medication at the time that is safest for your body, or simply at the time you were first told years ago? That is not a small question. For some people, it may be one of the most important medication questions they ever ask. I'm Dr. Clara Hoffman, and if no one has explained this to you clearly before, then this is the conversation you deserve to have. If you want, next I can also give you